Hello, I'm Dr. Wickham Simonds. I'm an obesity medicine specialist from the Triangle region of North Carolina, and this is Obesity Medicine Perspective. You might remember on the last videos I was talking about a large study going on in Europe called the PURE study, which has vindicated the role of fat in the human diet there. Is not having anything to do with cardiovascular disease, and in fact being protective against cardiovascular disease. I then went on and explained that the role of carbohydrates, that as the proportion of carbohydrates increased, there's a direct correlation with the incidence of cardiovascular disease. So this is a theme that we teach in our practice, and I want to continue to touch on this because I get some of the strangest comments. I harp and harp and harp and harp on carbohydrates all the time here in my office, and yet I get so many comments when I look at what people are eating and they tell me what they're eating. It's clear that in many people there's just a disconnect between what they think a carbohydrate is and what a carbohydrate really is. So I want to take a couple videos and just go back over this again so that people get this concept, okay? Carbohydrates are anything that breaks down, and by my definition, anything that breaks down to blood sugar. All right, so if it breaks down to blood sugar, remember I told you your blood sugar rises, you have to make insulin, and insulin's the enemy in this case. This is what makes you hold on to weight and keeps you from losing weight. So I think where the confusion comes in is people kind of, over the years, have associated carbohydrate with just certain things. So they say, well, I'm not eating any carbohydrate. And I'll say, well, what are you eating? Well, I'm not eating any rice or potatoes. And they'll say, well, I'm not eating any bread. And I'll say, well, what are you eating? Well, I'm eating some Kashi cereal or some whole grain cereal for breakfast. Maybe I have a yogurt with fruit on the bottom of it. Say for lunch, maybe I'll put some granola in there. I'll have some Triscuits and a piece of fruit as a snack, you know, or some pretzels. And they don't think those things are carbohydrates that I just said. And I'm here to tell you that every form of cereal that you can buy anywhere is a carbohydrate. I don't care if it's whole wheat, I don't care if it's whole grain, and I don't care what the advertiser says about it, okay? It's a carbohydrate, and all you're doing is giving your body a big bolus of carbohydrate when you eat it. The same is true of every form of cracker that has ever been made. I do not care about the source of the grain that goes in there. I don't care if it's whole wheat or whatever. This stuff keeps you from losing weight. Pretzels, yogurt with fruit on the bottom. Look, fruit has sugar, and it has historically more sugar now than it has ever had, which is why it's so sweet and much more comparable to candy than it is to actual something healthy anymore. So you won't find this product, this deal with vegetables. So I want to be just clear about this. It's not just rice and potatoes and bread. Okay, it's every form of bread, cracker, cereal, refined grain of any kind. So everything on the middle aisles of the grocery store that is in a bag or in a box, and it is all forms of rice or potato, not just white rice and potatoes, sweet potato, brown rice, quinoa, all of it. It's all grains, and it's all grains and starch, and it turns into sugar, and it is a carbohydrate. And then on the next video, I'm going to move on to just a few finer points about this, okay? Because there's not a difference between sweets and carbohydrates, so we're going to talk about that on the next video. So I just want to really encourage you to buckle down, and let's make sure that you don't have carbohydrates in your diet preventing you from losing weight, and you think there's some sort of healthy carb, so you think it's okay, and then you don't understand why you're not losing weight. No, you got to get them out of there, okay? All those things I talked about are carbs, and if you want to lose weight, it's good to get them out of your diet. So until we talk the next time, I'll give you the tools, you give me the effort, and together we overcome obesity.